Hello, hello. Happy Monday. Okay, we are on. So today is Monday, February the 12th, 2024. And welcome to another Medical Monday. It is Monday. Hope everybody's doing great and you had a wonderful weekend. Also want to remind you, Wednesday is Valentine's Day. So in case you're super busy like I am and need a reminder, this is your reminder. But I do also want to let you know that here at the studio at Nourish Wellness, we have a very special event on Valentine's Day. It is a couples sound bath. It includes gentle yoga. It includes some nice activities that help you connect on a deeper level with your significant other. And then you get a sound bath, a relaxing sound bath at the end, and you get some plant-based snacks and gourmet chocolate, which I ordered some amazing chocolate that I can't wait to try with some amazing flavors. So if you want to sign up for that, go to the website Nourish Yakima. There's going to be a link there to classes and events. Or you can go on social media. You can find all the links there. So that is this Valentine's Day at 5:30 p.m. It goes for an hour and a half. Also super excited that Melissa Durbin, who is one of our fabulous mental health therapists here in the community, is going to be giving a class on anxiety. So that's going to be coming up at the end of the month. So we'll be announcing the dates and the topic for that later this week. So be on the lookout for that, especially if you or your child or somebody else struggles with anxiety. I think this is going to be really helpful. Anxiety is very, very common. We've all experienced it at some point in our lives, but with the modern world and everything that we've been through, it's becoming more and more common. But I think also parents are just more receptive to it in their children. And so it's coming up a lot. And I think parents want to get all the resources that they can to help their kids get through this. And so Melissa is going to educate you on anxiety and the different things that you can do and things that you can expect with that. Also, so back to the studio, we do have yoga and meditation classes 7 days a week. I also teach a nutrition class at least once, sometimes twice a month. We have Food for Life cooking classes every month now. There's so many different classes, all to support your healthy lifestyle, well-being, and longevity. So I created the studio so that it can support the practice and the habits and behaviors for well-being and longevity. The price for the membership is very reasonable, but if you just want to try it out, you could do class by class, or you could buy packages, bring a friend, come try it out. There's lots of different classes for all different levels and experience levels. But like I said, we also have lectures that will help you learn. And at the practice here at Nourish Wellness, we're also accepting new patients. We have plenty of same-day appointments available. You can text us when you need help with your child. We are very accessible. So if you are looking for a pediatrician, come join us. It's me and Carly Domes here at the practice, and we would be so happy to see your children. Okay, so today I'm going to discuss, let's see, 1, 2, 3 different studies that I came across this week. And also just to remind y'all, I love questions. So if you have questions, post them in the comments. Alejandra can help me pick those out if she sees them, but ask me questions at any time. So the first one is not, well, yes, it is a study, but it came out in Morbidity and Mortality Weekly Report, February 8th of 2024, entitled Characteristics of Alcohol, Marijuana, and other drug use among persons aged 13 to 18 years, being assessed for substance use disorder treatment, United States 2014 to 2022. So basically, this is a study in which they analyzed data on 9,500 teens being evaluated for substance use disorder between 2014 to 2022. So they had to have used a substance in the past 30 days. The most common substances were marijuana, alcohol, and alcohol. But what I really wanted to point out about this study goes back to that anxiety class that we're going to announce soon. The motivations for substance abuse, 73% wanted to feel mellow, calm, or relaxed. 50% to have fun or experiment. 44% to sleep better. 44% to stop worrying about a problem or forget bad memories. 41% to make something less boring, and 40% to help with depression or anxiety. So yeah, we have the ones where we're just thinking of teenagers, oh, they're just experimenting, they're just trying new things. But the majority of these teens, it really was because they wanted to alter their mood. They wanted to alter their emotions because they were feeling bad. And it's normal to have emotions that are not pleasant. It's part of life. It's part of being human. But sometimes for teenagers, it's harder for them because they may not, that frontal lobe is not fully developed. So they may not be able to see out into the future and know, hey, this is going to get better. I'm going to feel better eventually. So they're using these substances to soothe themselves. So a lot of these kids, they have depression or anxiety, they've had some sort of trauma, and they're using these substances to alter their state, to deal with that. So just know that's a good reminder for us as parents to take these mood issues seriously in kids, because they're going to try different things to feel better, just like we adults do. Sometimes we're doing things that are legal, like food and Netflix and things like that. But at the same time, we're also using substances to feel better. So all of us can learn ways to manage our thoughts and emotions. But as parents, being on the lookout, being aware that our kids, when they're suffering, they may turn to substances. And these are kids that ended up in substance use disorder treatment. So obviously, we do our best as parents, and sometimes we miss things. And so I don't want anybody to blame themselves or feel ashamed or anything. We're just doing the best we can. The other thing that they found in this study is that 81% said that they used with friends, but 50% reported using alone, which means that really is, it's not just, hey, I want to have fun, I want to, party with my friends. It's, I don't feel good, I want to feel different. Okay. So that's one thing to keep in mind there. Okay. This next one, I just realized that my AirPods weren't plugged in. Alejandra, can you still hear me? Okay. That's probably better. If your child has been asking for a dog, get them out of the room, because this study is going to be validating their case. Okay. So this next study is about dog ownership and physical activity. The name of the study is Longitudinal Effects of Dog Ownership, Dog Acquisition, and Dog Loss on Children's Movement Behaviors, Findings from the PLACE Cohort Study. This was published on January the 30th in the International Journal of Behavioral Nutrition and Physical Activity. So they, in this study, use data from the Play Spaces and Environments for Children's Physical Activity, also known as PLACE, cohort study, to examine the longitudinal effects of dog ownership status on children's movement behavior. So they followed 600 children over a 3-year period. And they tracked the change in dog ownership from preschool to full-time school. And they used the natural experiment with 4 distinct dog ownership groups. So people that had dogs that continued to have dogs, people that got a new dog, and people that lost a dog. Oh, and then people that never had a dog. So never had a dog, continue to have a dog, got a new dog during the study, and had a dog but lost a dog. So four different things. And then they studied movement behaviors, physical activity, sedentary time, sleep, screen time, and they used an accelerometer. So they were able to attach a device to the child, kind of like, Apple Watch or Fitbit or something like that, that can actually see how much the child is moving. So what they found is that girls who acquired a dog increased their light intensity activities by and games by 52 minutes a day. That's a lot because right now we recommend that children move for at least an hour a day. Okay. So the ones that went from not having a dog to having a dog, the girls increased their physical activity by 52 minutes. Girls who lost a dog decreased their light intensity activities and games by 62 minutes a day. So if they lost a dog, they were moving for 1 hour less per day compared to no change among non-dog owners. So they compared it to this natural group of people who never owned a dog. Those that gained a dog moved more. Those that lost a dog moved less. Girls and boys who acquired a dog increased their unstructured physical activity by 6.8 and 7.1 occasions per week compared to no changes among non-dog owners. And girls and boys who lost a dog reduced their unstructured physical activity by 10.2 occasions per week. Girls who lost a dog decreased their total physical activity by 46.3 minutes a day compared to no change among non-dog owners. Okay, so basically what this means is there can be incentives for kids to move, and having a pet like a dog, especially dogs, because dogs, they're easier to take outside, obviously on a leash. They want physical activity, they love physical activity, and they are incentivizing these kids to move in this unstructured, fun play sort of situation. So having a dog is associated with more movement when it comes to children, and these are from preschool to being in school age. However, you don't have to have a dog. So I do not advocate for having a dog if you know that you can't care for the dog well, if you're not going to be able to be home, or you travel a lot, have those situations where you're not going to be able to care for a dog, or it's just too much burden, or maybe somebody has a dog dander allergy or something like that. You can do these same things by being mindful and know that if you just leave it to the child themselves, they can end up sedentary. And in the article, they were saying that girls end up becoming sedentary faster than boys. But we know that for both boys and girls by middle school, they're already sedentary. They're sitting around, and it's not necessarily that they're doing bad things, but they may just be sitting and reading or on their iPad or playing video games, things like that. They're not moving around. And we know that for health and longevity, we need and we want that daily movement for children. If we can get at least an hour a day, that would be ideal. It doesn't have to be an hour at one time. We can break it up into lots of, little segments throughout the day. In school, some schools have PE, which is really helpful, or they have recess, which is really helpful. But even that, we can't count on and depend on, because some schools are losing that time because of other restrictions or academic necessities and things like that. So if you can't have a dog, then find other ways. Find other ways to routinely get that movement in. Make it a habit as a family, because it's good not just for the kids, it's good for the parents too. And we all want to age well together, be healthy, looking forward to those great grandchildren, down the road. So we got to keep ourselves healthy along with our kids. But when we practice these habits, our kids acquire. This weekend, I was visiting my son for his birthday. And for his 19th birthday, one of the activities that we did as a family is we all went to the gym together and we lifted weights, because we're all into the strength training now. So from the 14-year-old to the parents in our 40s, we were in the gym lifting. And then I got my swim in, because I've been trying to get better at my swimming. It is still a saga. So those that have been following my Ironman training, it's hard, but as a family, we did that. Then Sunday morning, my husband and my son both went for a run together. You know, they go mountain biking, they hike, they do all these things, but these are all things we've been doing since they were little. It doesn't require extra effort whenever you make it into a habit. So that study just points that out. Sometimes there's things that really incentivize kids to move, but if you can't do that thing, you can find other ways. Okay, let's see, what time is it? Okay, if anybody has any questions about anything, pop them into the chat, okay? Pop them into the comments and I will address them. But I just have one more study that I found interesting. So this one is um, vitamin D and marine omega-3 fatty acids for autoimmune disease prevention outcomes at 2 years after the VITAL trial completion. This was published January the 25th, 2024. And this study was actually a follow-up, not a follow-up, but it was a study, well, yeah, kind of a follow-up study from a previous study that was looking at the effects of supplementing vitamin D and omega-3, and that was called VITAL. And so the trial was called VITAL, and it was designed primarily to study the effects of vitamin D and omega-3 supplementation on cancer and cardiovascular disease. So they showed that 5 years of vitamin D supplementation was associated with a 22% reduction in risk for confirmed autoimmune diseases, and 5 years of omega-3 fatty acid supplementation was associated with an 18% reduction in confirmed and probable incident immune diseases. So in this trial, they actually looked at the follow-up. So they looked at 2 years post-intervention. So in that first trial, it was 5 years of doing the intervention. They finished the trial, and now they're looking 2 years later. And let's see, how many people did they have? So this was randomized 2x2 factorial double-blind placebo-controlled vitamin D and omega-3. And then they aimed to confirm further autoimmune disease cases arising during and after randomization and assess sustained effects with 2 years of post-intervention observation. So they had 12,787 men greater than 50 and 13,085 women greater than 55 that they followed and were willing and surviving participants for more than 2 years. And what they found is that 2 years after the trial supplementation, this was after they're making these people take these supplements, okay? So what happened after we're done with the trial? Vitamin D, 2,000 international units a day, protective effects dissipated, but 1,000 milligrams a day of omega-3 fatty acids had a sustained effect in reducing autoimmune disease incidence. Vital observation extension results suggest that vitamin D supplementation should be given on a continuous basis for long-term prevention of autoimmune diseases. The beneficial effects of omega-3 fatty acids, however, may be prolonged for at least 2 years after discontinuation. The protective effect for vitamin D seems strongest for psoriasis, while for omega-3 fatty acids, the protective effects were strongest for rheumatoid arthritis and inflammatory bowel disease. So, my patients that come here know that I'm pretty big at recommending to making sure that we're taking our vitamin D supplements. And recently, in the past few years, I have also been recommending omega-3 fatty acid supplementation. Now, for us vegans, thankfully, omega-3 fatty acids don't come from fish, regardless of what you've been told. Fish get it from algae. So the fish are eating the algae, and then the algae gets stored in the fish fat. And so then you can take the fish fat and, isolate it from the fish fat, but that's like doing extra steps, So you can get it straight from a vegan algal oil. So if you're concerned about that, no problem. That also decreases the risk that you're going to get exposed to heavy metals like mercury and things like that. But, there is just more and more evidence to show that it's going to help the brain. It's going to help longevity, aging, especially for kids. So I do recommend it. And here in the Pacific Northwest, because of our latitude, we tend to be further away from the sun. So especially during the winter, like now, we'd have to be outside, middle of the day, arms and legs fully exposed for 2 hours to get enough vitamin D from the sun. So it's not that I don't recommend that we go into the sunlight, but it's nearly impossible to get it just from sun exposure. And there's lots of benefits to vitamin D, including our immune system and those kinds of things. So it took me a long time to get my vitamin D up to normal levels, and I finally got them up this year, but that was from very diligent supplementation. And I do go outside, but I also wear sunblock and try to protect my skin because, my plan is 100 plus of life, 100 plus years of life. So I want to try to keep my skin in good condition as well. So I think, I just thought that this was an interesting study because it's showing that vitamin D and omega-3 can be helpful to decrease the risk of autoimmune disease. We think of autoimmune disease as something that you just get. And yes, you do have to have genetic predisposition for it, but there are lifestyle things that we can do to decrease our risk for it. Okay, so those were the 3 studies that I wanted to cover. And now that I'm done with those studies, like I said, post questions if you have questions. If you aren't able to attend Medical Mondays live and you do have questions, general questions that you want me to answer during this time, you can also direct message us and we can include them in the recording. So I wanted to kind of go over UTIs because I think things always happen in clusters, even though maybe it's, urinary tract infections are not contagious to other people. But, we see things like this happening in clusters where we'll get a few cases sometimes a week. So one of the things, so urinary tract infection is an infection of the bladder. It can include, the ureters, which are the tubes that go down into the bladder from the kidneys and the kidneys. When it is a true kidney infection, that's called pyelonephritis, but sometimes it's hard to tell the difference. But what usually you see with a urinary tract infection, especially in older kids that can talk to you, is they have painful urination, so burning or pain when they urinate. They may have blood in their urine. They may feel like they have to pee frequently or feel urgency, like they have to go, but when they pee, it's just very little. Or a lot of kids start having accidents. They have wetting accidents. For younger babies, and younger children and babies, you may not know some of those symptoms because they can't talk to you, but they might have a fever with no other reason for the fever. Like they may not have cold symptoms or anything like that. They may seem very fussy. Sometimes the urine may smell foul, but if you suspect that your child is having a urinary tract infection, it's always better to see the physician because it can be more subtle in babies until it gets to the point where it causes fever and they're really sick. So urinary tract infections, the most common cause or the most common bacteria is going to be E. coli, which is a bacteria found in stool. So as you can imagine, there's everything down there is pretty close. And it really isn't necessarily about poor hygiene, but certain things can increase the risk. Like in toddlers and preschoolers, as they're learning to be potty trained, they may start withholding the urine. And so the urine is staying in the bladder longer. And as that urine is staying in the bladder longer, you have more time for bacteria to grow and multiply. Also, constipation, it can cause urine to be withheld in the bladder. And, there's different pelvic floor things where kids have trouble relaxing all the way and letting all the urine come out, or they may rush to go pee and not empty their bladder fully, those kinds of things. There are also some anatomical differences that can increase the risk of urinary tract infection. So there is such a thing as kidney reflux. So you've heard about reflux in your esophagus, so heartburn, esophageal reflux, but there's also such a thing as kidney reflux, where the urine is only supposed to go one way and there's a valve to keep it from going up. But sometimes those valves don't work and the urine goes back up into the ureters and into the kidneys, and it can even make it so that the kidneys swell. So, there's other things like posterior urethral valves, and there's all kinds of little anatomical things. But for the most part, kids are either withholding or they're constipated, or, it's just a fluke and they had bad luck. E. coli is the most common bacteria. So we would see them in the office. We would get a urine sample. We would test the urine in the office by doing a dipstick, see if it might be a urinary tract infection. And based on that, we may start antibiotics. And culture the urine. So we don't say that a UTI is for sure until that culture comes back as growing bacteria, because that is our gold standard to say, yes, this child had a urinary tract infection. So we see that urine culture, it's growing greater than 100,000 colony forming units of E. coli. And then what's really cool is that they do something called sensitivities, where they take that bacteria and they test different antibiotics against it and see which antibiotic kill it. We have one that we usually assume is going to work. So that's called giving empiric antibiotics. And then we await the culture and make sure that that's it. Sometimes in between, we may have a clue that it's not going to work if the child is getting worse or continues to have fever. So that's the basics on urinary tract infections. It is something that we do see quite a bit in children. Obviously, it's not ideal and it's not necessarily a great thing. And in some children, depending on whether they had a fever or what other circumstances, we may move on to do other testing to make sure that they don't have one of those anatomical differences. But if your child is having any of those symptoms, it is better if they get evaluated by their doctor to make sure, and that a culture is sent so that we can be 100% sure it was a urinary tract infection, and then we can take care of it. Okay, so it looks like I have a couple of comments from Video 1000 Nights. Dr. Yami, I wanted to give you a compliment as you are really good at interviewing other doctors and people. Some of the questions you asked Dr. Williams were very helpful. Well, thank you. I love interviewing. It's one of my favorite things. And then Video 1000 Nights also asked, do you think ultra low LDL, if whole food plant-based and statins, is a concern or helpful related to an Esselstyn type program? I don't think it's a problem. I'm not a cardiologist. So I can't tell you for sure based on personal experience of treating patients, but I know that what I've heard and what I've asked as far as cholesterol is that it's not a problem. And I naturally have very low cholesterol. I recently had my teenager checked and had his numbers checked again, and he has super low cholesterol. And we just eat, vegan, plant-based. And he's in college. So it's not like he's eating 100% whole foods either. But because of his lifestyle and genetics, we just have really low cholesterol and it's not a problem. So if you're concerned about it, definitely reach out to your cardiologist and ask. Okay, from Facebook, Tori Tarter asks, so we are big tea drinkers in the winter. That was a tongue twister. Tea drinkers in the winter. And my daughter sees us and wants some as well. So just wondering if tea is generally safe, okay. It's generally okay, safe for little ones, or if there are any that we should be cautious of. We usually let her have some that's pretty diluted, but still nice and warm. She's had some diluted chamomile before, but yeah, just wondering about tea and talk about non-caffeinated like chamomile, ginger, peppermint. Thank you for pointing that out, because yes, the first thing I was going to say is it should be non-caffeinated, obviously, because we don't want kids to have caffeine. The other thing you want to make sure of, and I addressed this in a podcast episode at some point. Alejandra, I don't know if you remember which podcast episode that was, because I asked one of the experts about it as well. And I would just make sure that you're getting from a good source, that it's organic and it's sourced in a way that you don't get heavy metals in it. I'm not a tea drinker just because it's hard for me. I actually tried to become a tea drinker because I feel like tea drinkers are like really sophisticated and, chill and stuff. But no, and it also spikes my cystitis and I feel like I have to pee all the time. But as long as you have an organic tea, non-caffeinated, and you make sure that you source from a place that you're not going to get metal exposure like leads and those kinds of things, no problem. I don't think it's a problem. But some people it becomes a bladder irritant for some people. So if you give it to your child and you see they have to pee like 4 times in the next hour, there might be a bladder irritant for them. So dilute it even more for them. What did you say? All right, let me see if I can put it on the private chat. She said something. Oh, so it is why you should add herbs to your well-being regimen with Dr. Bill Ross. I think I did ask him I think it was that podcast episode. So look up that one if you want more information on that, Tori. Okay, and I think those are all the questions I got, which is perfect because it's 1:59. Okay, I hope that everybody has a plantastic week and have a beautiful Valentine's Day, that you celebrate yourself and those that you love. And if you're in town and you want something fun to do, come to the couples sound bath yoga class and have some gourmet chocolate afterwards. I know I'm going to have one, so I'm super excited. So thank you all for watching. Thank you for the questions. I appreciate them so much. They help me and I love answering them. So thank you all for watching. I will see you next Monday with some more fun studies to go over. And I'll be happy to answer questions as well. So have a fantastic week, and I'll see you later.